That white gunk on your tongue could be quietly sabotaging your health, and you might not even realize it. A white tongue, characterized by a visible coating or patchy white film covering parts or all of the tongue surface, is one of those common but often misunderstood health signs that can range from completely harmless to medically concerning. At its most basic, this condition occurs when the tongue's papillae, those tiny bumps covering its surface, become swollen and trap bacteria, dead cells, and debris between them, creating that distinctive pale appearance. For most people, this manifests as a thin, uniform white layer that can easily be scraped or brushed away, typically nothing more than a sign that you need to pay better attention to your oral hygiene or drink more water. However, in other cases, the white coating may appear thicker, take on a cottage cheese-like texture, form lacy patterns, or develop into stubborn patches that resist removal, each variation hinting at different underlying causes that demand specific attention. The spectrum of potential causes is surprisingly wide, with the most common and least worrisome being simple poor oral hygiene. When we neglect proper brushing and flossing, bacteria flourish, creating both that white film and the bad breath that often accompanies it. Similarly, dehydration and dry mouth, whether from inadequate water intake, certain medications, or mouth breathing, allow dead cells to accumulate, while smokers frequently develop white patches from constant tobacco irritation. More concerning but less common is oral thrush, a yeast infection caused by candida overgrowth that creates thick, curd-like white lesions that may bleed when scraped, particularly prevalent in infants, the elderly, and those with compromised immune systems. At the more serious end of the spectrum lie conditions like leukoplakia, precancerous white patches strongly linked to tobacco use, and oral lichen planus, an inflammatory autoimmune condition, both requiring professional diagnosis and treatment. Even geographic tongue, with harmless but strange map-like white and red patterns, can cause unnecessary alarm if not properly understood. What makes white tongue particularly tricky is that while it's usually benign, there are certain red flags that should send you straight to a doctor or dentist. Patches that don't scrape off, persist beyond 2 weeks, cause pain or bleeding, or appear alongside other symptoms like difficulty swallowing or unexplained weight loss. The good news? Most cases respond well to simple interventions, improved oral care, including gentle tongue brushing and scraping, increased hydration, smoking cessation, and sometimes antifungal medication for thrush. Natural remedies like saltwater rinses and probiotic yogurt can help mild cases, while persistent or suspicious patches may require biopsy or prescription treatments. Prevention is straightforward but crucial. Maintain excellent oral hygiene, stay hydrated, limit alcohol and tobacco, manage stress, and keep up with regular dental checkups. Your tongue is actually one of your body's most honest health indicators. That white coating might be its way of telling you to slow down, drink up, brush better, or in rarer cases, seek professional help. The key is knowing when it's just a harmless buildup versus when it's waving a red flag that demands your attention. That unsettling white film on your tongue doesn't appear by magic. It's your body reacting to specific triggers. The most common culprit? Poor oral hygiene. When you skip proper brushing and flossing, bacteria throw a nonstop party on your tongue surface. These microscopic troublemakers mix with dead skin cells and food debris, creating that fuzzy white blanket you see in the mirror. It's nature's way of saying, time to pay attention to your mouth. But bacteria aren't the only offenders. Oral thrush, a yeast infection caused by candida fungus, transforms your tongue into a patchy white landscape resembling cottage cheese. While common in babies whose immune systems are still developing, adults get it too, especially those taking antibiotics, using asthma inhalers, or living with conditions like diabetes that weaken defenses. Ever wake up with a parched mouth and a white tongue? You're experiencing dry mouth in action. Saliva normally washes away debris, but when your mouth becomes a desert from dehydration, medications, or even stress, dead cells accumulate like dust in an abandoned house. Certain antidepressants, allergy meds, and even breathing through your mouth at night can trigger this effect. For smokers, that white coating might be leukoplakia, thick, stubborn patches that can be scraped off. These occur when tobacco smoke irritates the tongue over time. While usually harmless, about 3 to 5% of leukoplakia cases turn cancerous, making them a serious red flag. Stress can also manifest orally through lichen planus, creating lacy white lines that sometimes turn painful. Even your eating habits play a role. A diet heavy in soft, processed foods fails to naturally scrub your tongue, while excessive alcohol dries out your mouth. Surprisingly, even something as simple as fever can leave your tongue temporarily white as your body fights infection. The key is observing patterns. Does the whiteness come and go? Is it worse in the mornings? Your tongue's appearance acts like a dashboard warning light, with different causes requiring different solutions. While a white tongue often stems from harmless causes, its persistence or particular patterns can signal when professional help is needed. Understanding these triggers empowers you to take the right action, whether that's grabbing a tongue scraper or scheduling a doctor's visit. Your tongue tells a story about your overall health. Learning to read its signs might just save you from bigger problems down the road. Notice your white tongue appears mostly in the morning? Try drinking a glass of water before bed and sleeping on your side. You might be mouth breathing without realizing it. Your tongue is sending you warning signals. Here's how to decode them before it's too late. That white coating on your tongue isn't always innocent. Your mouth has an entire vocabulary of warning signs that most people completely ignore. A thin, uniform white film that disappears after brushing? That's your tongue's version of a gentle reminder to improve your oral hygiene. But when that coating evolves into thick, sticky patches that cling like glue or worse, starts bleeding or causing pain, your body is sounding alarm bells you can't afford to dismiss. The difference between no big deal and see a doctor immediately often comes down to three crucial factors: texture, duration, and accompanying symptoms. Normal, harmless white tongue typically looks like a light dusting of snow that easily wipes away with a toothbrush or tongue scraper, doesn't cause discomfort, and comes and goes based on your hydration levels or oral care routine. But when those white patches develop a cottage cheese-like consistency, appear alongside a persistent metallic taste in your mouth, or refuse to budge after 2 weeks of proper oral care, you're likely dealing with something more serious than just bacterial buildup. The most alarming variations include patches that resemble spilled paint, possible oral lichen planus, lesions that bleed when touched, potential oral thrush or worse, or any white spots that appear hardened or raised above the tongue surface, a hallmark of leukoplakia. Pain transforms a curious symptom into an urgent one, whether the general soreness, burning sensation when eating spicy foods, or specific tender spots under the white coating. Equally concerning is when the white tongue comes with other symptoms like unexplained bad breath that won't quit, difficulty swallowing, or the sensation that something's constantly stuck in your throat. Duration matters tremendously here. While post-antibiotic white tongue might clear in a few days, persistent coatings that last beyond the 2-week mark demand professional evaluation. Particularly dangerous are white patches that appear alongside red lesions, possible erythroplakia, which has even higher cancer potential than leukoplakia, or those that develop on the sides or underside of the tongue rather than the top surface. Smokers and heavy drinkers should be hypervigilant, as their risk for precancerous changes multiplies significantly. Even the pattern of the whiteness tells a story. Geographic tongue creates map-like patterns that migrate, while oral thrush often starts at the back and spreads forward. The moment your white tongue starts affecting your ability to taste, or you notice unexplained weight loss accompanying it, drop everything and call your doctor. These are red flags that transcend typical oral health issues. Parents should pay special attention to infants with white tongues. While breastfeeding residue washes away easily, thrush patches will resist wiping and may make feeding painful for the baby. Diabetics and immunocompromised individuals need to be equally vigilant, as their bodies struggle harder to fight off fungal and bacterial overgrowths. The scary truth? Many oral cancers start as harmless, white patches that people ignore for months until it's too late. Your action plan should be straightforward. Monitor for changes daily. Photograph your tongue under consistent lighting if tracking progress, and never hesitate to seek professional evaluation for anything that feels off. Remember, your tongue is one of the most vascular organs in your body. What happens there rarely stays there, making these warning signs your early detection system for everything from vitamin deficiencies to autoimmune disorders. The difference between catching something early and waiting too long could literally save your life. So the next time you brush your teeth, take an extra 10 seconds to really look at your tongue. Your future self might thank you for it. Critical checklist. Does it scrape off easily? Good. Is there pain or bleeding? Bad. Has it persisted greater than 14 days? Dangerous. Are there other symptoms? Alarming. Does it look/feel different today? Concerning. Your tongue doesn't lie. Learn to listen to what it's telling you. Don't just scrub that white tongue away. Here's the right way to banish it for good, and when you're making it worse. That stubborn white coating on your tongue isn't going to disappear with your usual rush brushing. But before you reach for harsh scrapers or dangerous home remedies, you need to understand there's an art and science to effectively treating white tongue based on what's actually causing it. For the majority of cases caused by simple bacterial buildup, the treatment protocol is refreshingly straightforward. Start by gently brushing your tongue with a soft bristled toothbrush using backward sweeping motions. Never scrub aggressively. You'll just irritate the delicate papillae. Follow a metal or copper tongue scraper used from back to front. These remove debris more effectively than brushes alone. And make this a twice daily ritual, just like toothbrushing. Hydration is your secret weapon. Drinking at least 8 glasses of water daily creates an environment where bacteria can't thrive. While those struggling with chronic dry mouth should consider xylitol-containing gums or lozenges to stimulate saliva production without sugar. The humble saltwater rinse, 1/2 teaspoon sea salt in warm water swish for 30 seconds, works wonders by creating an alkaline environment hostile to bacteria and fungi. Do this morning and night after brushing for best results. But when you're dealing with an actual infection like oral thrush, these basic measures won't cut it. You'll need targeted antifungal treatment in the form of Nistin suspensions or clotrimazole lozenges prescribed by your doctor, typically used for 7 to 14 days until all symptoms disappear. And yes, you must complete the full course even after the white patches vanish. For those suspicious thick patches that won't scrape off no matter what you try, especially if you're a smoker or heavy drinker, this isn't a time for home experimentation. Persistent leukoplakia requires professional evaluation and possibly biopsy to rule out precancerous changes. The substances you eliminate matter as much as the treatments you add. Smoking and alcohol not only worsen existing white tongue, but actively prevent healing by drying oral tissues and suppressing immune function, while alcohol-based mouthwashes nuke your mouth's good bacteria along with the bad, creating imbalance. Sugary foods feed the very organisms causing your problems, especially candida yeast. Making dietary modification crucial. Reduce refined carbs and increase probiotic-rich foods like unsweetened yogurt, kefir, and fermented vegetables to restore microbial balance. Surprisingly, your toothpaste choice matters more than you think. Many commercial toothpaste contain sodium lauryl sulfate, SLS, a foaming agent that can irritate sensitive oral tissues and exacerbate white tongue in susceptible individuals. Switching to an SLS-free formula often brings noticeable improvement. For those dealing with medication-induced dry mouth, a common side effect of antidepressants, antihistamines, and blood pressure medications, discuss alternatives with your prescriber or add moisture-boosting strategies like sleeping with a humidifier. The timeline for improvement varies. Simple bacterial coatings should show noticeable reduction within 3 to 5 days of proper care, while thrush may take up to 2 weeks of antifungal treatment, and leukoplakia might not resolve without professional intervention. Track your progress by photographing your tongue at the same time daily under consistent lighting. This objective record helps determine whether your interventions are working or if you need to escalate treatment. Natural remedies have their place, but require realistic expectations. Coconut oil pulling. Swishing 1 tablespoon virgin coconut oil for 15 to 20 minutes daily. Shows promise for mild bacterial and fungal overgrowth due to its lauric acid content, while aloe vera juice rinses can soothe inflamed tissues. However, these should complement, not replace medical treatments for confirmed infections. The ultimate prevention strategy combines all these elements. Meticulous oral hygiene tailored to your tongue's needs. Staying optimally hydrated, eliminating irritants like tobacco, managing underlying conditions, especially diabetes, and regular dental checkups to catch problems early. Remember, your tongue's appearance is a direct reflection of your overall health. By addressing white tongue properly, you're not just improving your oral environment, but potentially identifying and correcting systemic imbalances before they become serious health issues. The next time you stick out your tongue at the mirror, you'll know your tongue is the unsung hero of your mouth. Treat it right, and it will reward you with fresh breath, better taste, and crucial health warnings. Maintaining a healthy, pink tongue isn't about occasional fixes. It's about building smart daily habits that become second nature. The golden rule? Brush twice daily with proper technique. That means gently sweeping your toothbrush from the back to the front of your tongue, no harsh scrubbing, as part of your regular toothbrushing routine. But brushing alone isn't enough. Invest in a quality tongue scraper. Copper or stainless steel work best. And use it every morning to remove overnight bacterial buildup before it can accumulate. Hydration is your tongue's best friend. Aim for at least 2 liters of water daily to keep your mouth's ecosystem balanced and prevent the dry environment where harmful bacteria thrive. Your dentist is your tongue's guardian angel. Those twice-yearly checkups do more than just clean your teeth. They allow professionals to spot early warning signs of thrush, leukoplakia, or other issues you might miss. Make these appointments non-negotiable, just like changing your car's oil regularly. For smokers or those with chronic dry mouth, consider quarterly dental visits instead of biannual ones. That extra monitoring can mean early detection of potential problems. The magic of morning observation. Get in the habit of checking your tongue first thing every morning before brushing or drinking coffee. A quick glance under good light takes seconds, but provides valuable daily feedback about your oral and overall health. Notice changes in color, texture, or sensitivity. That's your cue to adjust your habits or seek professional advice. Your tongue's worst enemies? Smoking tops the list. It literally suffocates your taste buds and stains tongue papillae, followed by alcohol-based mouthwashes that nuke good bacteria along with the bad, and sugary diets that feed harmful oral microbes. The winning trio for tongue health? Consistent hydration, probiotic-rich foods like yogurt and kefir, and stress management, since tension often leads to teeth grinding and tongue pressing. Remember, a healthy tongue should be uniformly pink, moist, and slightly rough. Any deviation is worth investigating. That beautiful pink color isn't just cosmetic. It's a visual confirmation that your oral microbiome is balanced, your hydration is on point, and your body's warning systems are functioning properly. Consider your mouth's version of a check engine light. When it's pink, all systems are go. Keep a tongue diary. If you're prone to issues, snap a daily photo at the same time. Morning is best. To track changes over time. Apps like My Oral Health make this easy and can even help you share progress with your dentist. Your tongue does so much for you. Tasting, speaking, swallowing. Isn't it time you return the favor with proper daily care? That perfect pink isn't just attractive. It's a badge of honor proving you've mastered one of healthcare's simplest yet most overlooked wellness practices. Now go show your tongue some love. Healthy tongue checklist. Pink color, no white/yellow coating. Moist surface, not dry or cracked. Even texture, no unusual patches. No pain or burning sensation. Fresh taste, no metallic/bitter aftertaste.